for building resilient and sustainable health systems. We've titled this, Are You Ready?, to bring a spotlight to not only the ideas and perspectives on building resilience and sustainable health systems, but specific actions that people are taking that can really help with the transfer of new knowledge and ideas and learning in practical ways to support organizations as you lead to improve resilience across healthcare systems. So welcome, everyone. I see so many people joining from right around the world. We know that we've got over 1,700 registrants from over 20 countries, and this is true global learning in action. My name is Leslie Thompson, and I am the CEO of Health Organization and Accreditation Canada. And it's just great to serve in the role of moderator for this session. We have fantastic speakers who I'll introduce shortly, who will share stories and examples of ways they are leading change across many different settings. And I will get to that in just a few moments. A few opening remarks. Next slide, please. See everybody welcoming. Thank you very much. Okay, so what I'd like to do is, again, welcome all of you for our session and start by acknowledging and thanking the diverse Indigenous peoples whose presence marks this territory on which peoples of the world now gather. We open all sessions like this and our meetings with land acknowledgement that is part of our practice at HSO and Accreditation Canada, and we invite you to do the same. A couple of housekeeping items that you will see on your screens, that there is an opportunity to select the language that you wish to have the presentation proceed with, either English or French, and there is a spot at the bottom of your screen, and you can just select that, and that translation will be there for you. And it will be in English and French only, and we welcome you to use that tool to support your experience with this webinar. So let's dive in. I'm going to start initially with a focus of putting the call to action of building resilient and sustainable health systems to use. And I'm going to start with the slides. Team, are they coming up for you on the?
Yep, I'm just going to get them up for you, Leslie. My apologies. Okay. Running into
no worries.
A quick issue.
It's always
fun.
There's always a technical issue, and it's part of being resilient is we adapt and we change in order to be able to do this. But I'll start with an overall global view of the real imperatives that we are seeing around quality. And we're going to take a quality lens on this World Accreditation Day to think about the ways in which standards and assessments can help drive and support change to empower and enable people to improve quality. Our mission at Accreditation Canada, like many other accrediting bodies and standards organizations around the world, is really centered on empowering and enabling people around the world to continuously improve quality of care. And this is mobilizing the people with new knowledge and skills and resources to actually enact and take action that is improving quality. And part of that is having very specific language and evidence-informed standards and assessment programs that can support the aspiration and the gold standards and benchmarks for what quality high-performing health systems look like. When we've been talking with people around the world, looking at evidence recently of thinking about what does the future of quality look like, we know that there's a lot of challenges, especially post-COVID. And there's really about 6 major forces of change that are influencing the future of quality and tied to the notion of resilience. And these are, first, putting safety in all forms back on the front burner of change and in health systems. We've seen a slip of that within after COVID, addressing global workforce crisis, co-producing the future of health and care, ensuring that all voices are heard, reducing inequities, including real access to high quality care, and improving the health and well-being of communities, being front and center, thinking about health, not only healthcare. The other 2 major imperatives are around mitigating risks to planetary health and accelerating the use of technology for new models of care and personalized outcomes. And so what does all of that have to do with resilience? Well, what is health system resilience? To set the stage for the discussion that you're going to hear, we put together some definitions and that we'll share with you, all drawn from the literature, from reports, and various sources of input to really help ground us today. We're defining health system resilience as the capacity and the capability to absorb, adapt, or transform in order to maintain essential functions when the system experiences high degrees of stress or shock. Addressing resilience requires a deep understanding of community and population needs, of standards and accountability systems that transcend organization sector boundaries, that bring proactive citizen engagement and team-based problem solving, and ongoing monitoring and evaluation and readiness assessments. These are all activities and approaches of high resilient organizations and systems. We also know, especially post-COVID, that learning health systems help prepare people in a much more effective way, and that resilience is increased when learning is built into the fabric of the quality improvement agenda for health systems. So today's presenters, we have 3 incredible presenters today. And each of them are bringing perspectives on resilience with activities and ideas and practical solutions that you can learn from and that will stimulate great discussion today. First of all, we're going to hear from Joanna Marie Alvaro Eldiaz, Head of Quality Control, the Medical Affairs Division at Qatar Red Crescent. And Monica Makaladov, who is the Chief Nursing Officer and Vice President of Quality, Cultural Safety, and Humility from the First Nations Health Authority. And Sharon Isaacs, the Vice President of University Health Network, and who is a leader in the Connected Care program that you're going to hear about today. Each of these incredible leaders is sharing their stories, their expertise, and perspectives that we hope will stimulate your thinking and exchange of ideas to improve resilience across health systems in your own local areas, as well as more connecting with others to support improving health system resilience globally. Joanna. Thank you very much.
Thank you very much, Leslie. Good afternoon, everybody. Okay. So Hello, everyone. Welcome and thank you for joining this session. I am excited to share with you an insightful exploration into how accreditation fundamentally enhances our ability to respond to crisis. Today, I will provide you with an overview of our existing capabilities. Following that, we will uncover the layers of preparedness that accreditation brings to the forefront, ensuring that when a crisis strikes, we are not just reacting, but are steps ahead, ready to serve effectively. QRCS organizational structure. Qatar Red Crescent Society is a key member of the International Federation of Red Cross and Red Crescent Societies. Our organization is structured into 5 primary divisions, each tailored to maximize our impact both locally and globally. We have 2 supportive services division, which ensures seamless operations through logistics, human resources, communication, and administrative support. The Volunteering and Internal Development Division, which engages and empowers our community through robust volunteering programs and local initiatives. The Relief and International Programs Division, which focuses on providing emergency response and sustainable development aid across borders. And of course, the Medical Affairs Division, which is the focal point of today's discussion. The Medical Affairs Division at Qatar Red Crescent has shown a remarkable growth and adaptation over the past decade. We operate 4 primary care facilities starting in 2010, with 5,900 visits annually, and we have experienced exponential growth. By 2020, our facilities now cater to approximately 1.2 million visits each year, demonstrating our significant role in the community health. Our health workforce is comprised of 152 physicians, 225 nurses, and 184 allied health professionals. This expansion not only reflects our commitment to healthcare, but also underscores the trust and resilience placed in us by the communities we serve. When it comes to resilience in healthcare, the COVID-19 pandemic has profoundly tested our capabilities. During the global crisis, the Qatar Red Crescent Society was called upon by the Ministry of Public Health to manage the critical projects, the mechanism hotel quarantine. This extensive project involved managing 3,100 residential houses with a total bed capacity of 25,360 distributed across 12 blocks designated exclusively for quarantine. The quarantine facility was organized into several zones, including male blocks, female blocks, close contact blocks, positive and reactive blocks, and a high-risk country zone. This formidable undertaking not only tested our operational capabilities, but also underscored our commitment to public health and safety, requiring collaborative efforts across multiple sectors, with QRCS playing a key role in its successful execution. The mechanism hotel quarantine operated from August 2020 to September 2022 with a total of 655,650 admissions. In the heart of our medical operations, the QRCS has a field hospital that can rapidly be deployed. This state-of-the-art facility is equipped to provide immediate and comprehensive medical services during crisis. The field hospital is a testament to QRCS capacity to extend crucial medical services swiftly and efficiently, ensuring that we remain at the forefront of emergency response. With this foundation of rapid deployment and state-of-the-art medical facilities, Let us now explore how our commitment to accreditation enhance these capabilities further, ensuring our preparation and response are not only swift, but also aligned with the highest standards of global healthcare practices. The journey to achieving accreditation from Accreditation Canada in March 2023 marked a critical transformation for QRCS Medical Affairs Division, especially in our disaster preparedness and emergency response at the facility and in the community. The stringent standards set by the Accreditation Canada have led us to refine and enhance several key aspects of our operations. Our policies and procedures underwent a thorough review and revision. This process aligned them closely with the National Preparedness Plan, ensuring consistency and coherence in our response strategies. The accreditation process reinforced the importance of ongoing dialogue between healthcare institutions. This continued communication has been crucial in sharing best practices and coordinating efforts more effectively, which is essential for community-wide resilience. One of the core aspects of resilience is having a dedicated leadership. During our preparation for accreditation, we officially assigned personnel responsible for managing emergency responses. This clear delineation of roles ensures swift action and accountability during crisis. And perhaps most significantly, there has been a substantial improvement in our disaster planning process. This includes not only the development of robust plans, but also their meticulous implementation and ongoing evaluation. These steps are critical for continuous improvement and readiness. Our accreditation journey has transformed theoretical standards into practical actions that significantly enhance our capacity to manage and mitigate crises effectively. Tangible improvements in preparedness through accreditation has not only heightened our standards, but has directly translated into specific actionable improvements within QRCS. These enhancements ensure that we are not just ready on paper, but truly prepared in practice. Here are some key examples of how accreditation has bolstered our preparedness. We now conduct regular mock drills that simulate various emergency scenarios. This practice ensures that all team members are proficient in their roles and response during an actual crisis, enhancing our operational readiness. Our disaster preparedness forms have been meticulously revised to ensure comprehensive data collection and response planning. This revision helps streamline our actions and responses during emergencies. We have developed and distributed emergency preparedness kits that are equipped with essential supplies, and these kits are strategically placed across all facilities to ensure immediate accessibility in the event of a disaster. Investments have been made to purchase additional materials and resources that are crucial for effective disaster management. This includes medical supplies, communication devices, and other emergency response tools. Accreditation also has helped clarify and assign roles and responsibilities for disaster response. Every team member is now fully aware of their specific duties, which is critical for coordinated and efficient action during emergencies. These initiatives have significantly strengthened our disaster preparedness. Through accreditation, we have enhanced not just our capacity to respond, but also our effectiveness in managing and mitigating crises. As part of our ongoing community resilience, QRCS has launched an innovative 3-day field hospital course. This course is a cornerstone in our strategy to not only respond to crisis, but to actively prepare the community and our teams for effective emergency management. Participants dive into the foundational principles of field hospitals operations, covering everything from rapid deployment to efficient care management. This theoretical groundwork ensures that all participants share a unified understanding of the critical role of these facilities play during disasters. There is also an interactive workshops where participants engage in hands-on planning exercises. They learn to determine the optimal plans and placements for field hospitals, considering various emergency scenarios. The culmination of the course is a practical exercise where participants have the chance to participate in the actual setting up of a field hospital. This hands-on experience is invaluable, allowing participants to apply their learned skills in a controlled, realistic environment, thereby reinforcing their knowledge and preparedness. This comprehensive course is just one of the many ways QRCS is leveraging accreditation to enhance our capabilities and community resilience. By educating and empowering our staff and volunteers, we are ensuring that our response to any disaster is not only immediate, but also highly effective. Having highlighted the tangible improvements we've made through our commitment to accreditation, it's clear that these advancements have significantly enhanced our preparedness and response capabilities. But our journey doesn't end here. As we look into the future, our strategy for enhancing community resilience and operational efficiency is categorized into 3 areas. Firstly, under community engagement, we aim to expand our community outreach programs. This expansion is designed to educate and involve more individuals in disaster preparedness and response initiatives, enhancing our collective resilience. Additionally, we will foster stronger relationships with both local and international organizations, which is crucial for enhancing collaborative efforts in crisis management. Secondly, we will enhance our training programs. Here, we are committed to developing and implementing advanced training modules for our healthcare professionals and volunteers, concentrating on the latest best practices in crisis response. Furthermore, we will introduce regular refresher courses and workshops to ensure continuous skill development and readiness among our team members. Lastly, our sustainability initiatives are designed to enhance our long-term resilience. We plan to strengthen our disaster recovery plans, ensuring a quick and effective return to normal operations following any crisis. Moreover, we will focus on sustainability initiatives that enhance the resilience of our facilities and operations against future challenges, preparing us to face any adversities. Together, these initiatives will ensure that Qatar Red Crescent Society not only maintains its position as a leader in crisis preparedness and response, but continues to set new standards of excellence in healthcare and community service. Our journey is ongoing, and with each step forward, we are building a safer, more resilient future for all. As we conclude our today's presentation, I want to emphasize the profound impact that accreditation and proactive planning have on enhancing our crisis preparedness and community resilience at Qatar Red Crescent Medical Affairs Division. Through this, we have solidified our commitment to saving lives and preserving dignity, which is at the core of everything that we do. The ethos of saving lives and preserving dignity is not just a slogan for us. It is the driving force behind every initiative, every policy, and every action we take. From our comprehensive training programs and state-of-the-art facilities to our relentless pursuit of quality and excellence, every step is taken with the goal of ensuring that we can respond to crisis swiftly and effectively while upholding the dignity of those we serve. Thank you for your attention and for joining us in this vital mission. Together, we are not just preparing for the future, we are actively shaping it to be a safer and more resilient for everyone. Together, we can continue to make a difference, saving lives and preserving dignity every step of the way. Thank you very much.
Thank you very much. That was just a fantastic presentation, Joanna, and you really showcased the very specific ways that you're putting the definition of health system resilience into action, which is the capacity and capability to absorb, adapt, and transform in order to maintain those essential functions while and the system experiences stress or shock, and preparing your organization, your community, and your providers to do that through the use of standards and accreditation to mobilize people toward that goal. So congratulations and thank you very much for sharing that experience. We'll be back as part of the conversation later. And now, Monica, we're going to move from Qatar to the west coast of Canada and to focus in on your incredible experience and leadership with so many partners with the First Nations Health Authority. And we look forward to hearing from you about building resilient and sustainable health systems through co-production of the Cultural Safety and Humility Standard in British Columbia. Welcome, Monica.
Thank you, Leslie, for that wonderful opening. And also I want to raise my hands to Joanna for that great first initial presentation. Good day, everybody. I first of all want to acknowledge that I'm calling in today from the traditional territories of the Tsawwassen Nation here, also known as Hope, British Columbia, Canada, where I'm a guest and able to be speaking from today. As Leslie mentioned, I'm here to speak about the important role of co-production in the development and testing of the BC Culture, Safety, and Humility Standard. I'm going to walk you through our co-production journey and how we are continuing in this collaborative work, and also reflect on how the standard supports a more inclusive and resilient healthcare system. And I'm going to start off with an overview of why the standard is important and how it was developed. So why do we need a standard? Systemic racism is a well-documented problem throughout the health system. To build resilience for not only for our clients, but for the staff is imperative. While the work of the BC Culture, Safety, and Humility Standard began before the publication of the In Plain Sight report, which was a provincial Ministry of Health commissioned report, the report recognized the importance of this work, and recommendation number 8 of the In Plain Sight report specifically asked for a BC Cultural Safety and Humility Assessment Standard. At First Nations Health Authority, Cultural Safety and Humility is embedded in all the work that we do. It starts with all of us through a process of honest self-reflection. Cultural safety can only be defined by Indigenous people. Cultural safety is an outcome based on respectful engagement that recognizes and strives to address power imbalances inherent in the health system. It results in an environment free of racism and discrimination, where people feel safe when receiving health care. Cultural humility is a lifelong process of self-reflection to understand our own biases and foster respectful processes and relationships based on mutual trust. Cultural humility involves humbly acknowledging oneself as a learner when it comes to understanding another's experience. The standard, first of its kind in Canada, was developed to address long-standing issues of Indigenous-specific racism across the healthcare system. In partnership with health standards organizations, First Nations Health Authority, the BC Cultural Safety and Humility Organizational Reference Standard was created in June of 2022. It has been endorsed by the First Nations Health Council and the First Nations Health Directors Association, which is our First Nations health government structure in British Columbia. And there was a resolution passed by the Assembly of First Nations in 2023 to not only endorse the standard, but to lead the work on creating a national Canadian standard on cultural safety and humility. We are now collaborating on how to implement this assessment standard. So co-design has been an integral part of the culture, safety, and humility standard. So now wanting to highlight some of the ways that we worked in partnership on developing and testing of the standard. So there has been an Indigenous-led technical committee co-chaired by Elder Jerry Ullman and Dr. Nell Wyman, who is our First Nations Health Authority Chief Medical Health Officer. So it's been comprised of First Nation patient partners and family members, as well as health professionals, policymakers, and academics from British Columbia. There's been a two-eyed seeing approach, which blends Indigenous knowledge and experiences with the Health Standards Organization standards development process. It's received over 1,100 comments during the public review process, and we really wanted to make sure that there was representation of the patient voice and the stakeholders within the system. The work on building the standard happened over a 4-year period. The technical committee never wavered and continued their work despite all the challenges of competing demands of the COVID-19 pandemic. While the standard was available for reference and guidance since June of 2022, a renewed partnership between First Nations Health Authority, Health Standards Organization, and Accreditation Canada began in December of 2022 to continue advancing this work into an accreditation-ready standard. First Nations Health Authority and Health Standards Organizations convened an Indigenous classification working group to ensure the standard would be implemented in a culturally safe way, and I was very honored to be part of that working group. The working group looked at each of the criteria in the standard to identify the priority level assessment approach that best fit that criteria. The working group then provided recommendations to Accreditation Canada on how to assess the standard in a culturally safe way, highlighting that since cultural safety can only be defined by the person accessing the services, Indigenous patient partners should be involved in all surveys. Surveyors should undergo comprehensive distinctions and strength-based cultural safety and humility training. And surveyors' competencies must be co-designed with Indigenous partners. Indigenous partners must also be supported culturally, with their mental health, and with wellness supports. Understanding that First Nations Health Authority needs to lead by example in this space, we also voluntarily undertook our own self-assessment. We grounded this work in relationship and culture. In order to get a bird's eye view on the organization, we brought together change champions from across the organization to support this work. And we were graciously given the name Sisamaya by Elder Wendy Ritchie from the Skokiel Nation. Elder Wendy highlighted that change champions were like bees, and she shared, bees have a big job keeping our environment alive and well. They all work together and think alike to protect their queen and their home, making sweet honey for all to enjoy. We tried to function as a safe space to work together to break down silos across the organization. We ensured that there was a coordinated and effective approach to our self-assessment, and we established relationships to further align the organization with the cultural safety and humility standard. And part of the work was to take our own assessment and embed our own recommendations throughout the work already in place and really incorporate the standard in all the good work that we do, weaving it throughout the organization. In parallel with FNHA's internal self-assessment with the BC Culture, Safety and Humility Standard, we partnered with HSO and Accreditation Canada on testing out the assessment standard. From November of 2023 to March of this year, we invited client organizations of Accreditation Canada, so different health and social service organizations across the province, including our health authorities, to participate in a self-assessment pilot. Aim of the self-assessment was to learn from client organizations' experience to ensure that the standard is assessed in a good way. We undertook the pilot project to understand and take into consideration the complexities and challenges and opportunities that need to be considered as assessment standard moves into implementation. Participants of the self-assessments were invited to join us at our Community of Practice in-person gathering in February of 2024, where we celebrated the good work and learnings underway and emphasized that we're all on different parts of this journey, that cultural safety and humility isn't binary. We need to move towards a state of becoming rather than achieving. Importance of grounding this work in relationship, opening our circle, and prioritizing connection. This is an example of building system resiliency by partnership, support, and learning as a system in a way that creates capacity for everyone. Community of Practice, co-led by the Métis Nation of BC and First Nations Health Authority, created a space for sharing and learning, bringing BC health system quality leaders together to break down silos, promote knowledge exchange, and work towards alignment and adoption of the BC Culture Safety and Humility Standard. Participants are our colleagues across the health system, Indigenous health and accreditation teams at the BC Health Authorities, patient partners, and Health Quality BC. In February of this year, our Community of Practice came together for a week of learning together in person on the Songhees territory. On the slide, we have added the graphic recording from the session, wanting to highlight much of our discussion that week focused on collaboration, co-design, and co-creation as we work towards a common goal. What does co-design and good engagement look like? Take time to build relationships, validate what you have heard and read, work at a comfortable pace, find the right time, right people, ask the right questions, and use the right modality. Emphasis on learning the culture of the area that you live and work and play in. All throughout our cultural safety and humility journeys, we are unlearning and undoing the systemic racism and discrimination built in the healthcare system. This is an example of building system resiliency by creating capacity and support to health system organizations based on an accreditation reference standard that has clear expectations and directions for organizations. So the question to ask yourself, how might addressing cultural safety and humility in your organization improve client health outcomes and build up personal and organizational resiliency? Thank you.
Thank you so much, Monica. You have brought such a kind of a deeply personal and human account of the journey to kind of, I think the whole cultural safety and humility approach it really is about that building of resilience and the capacity of people to thrive in challenging situations, but in a way that is tied deeply to their traditions and cultures, and how building those solutions and ways forward needs to be done in new ways. And you've really provided us with some fantastic insight and examples of collaboration, co-design, and co-creation in BC with the use of the standard and the ideas for how it could be applied in the future. So thank you very much for that overview, and can't wait for the opening up of discussion as well. And now we're going to move from, we've started with a great focus on kind of that building resilience of overall health systems that we heard from Joanna, and the great example of Red Crescent Qatar, to the strengthening of communities and through cultural safety and humility lens on resilience. And now we're going to go to Sharon with a really fantastic example of work that's being led by a major academic health science network, deeply connected to their communities and carving out new paths for how knowledge of population needs can drive new approaches for resilience. So thank you, and look forward to this next presentation to round out our understanding of what resilience looks like around the world, and what ways accreditation and standards can help strengthen and build that capacity for the future.
That's great. Thank you for the introduction, Leslie, and happy Accreditation Day. I'm going to do my best to follow on the heels.
Yes, thank you.
Two great presentations. My conversation today, we really focused on some of the work that we're doing at University Health Network, as well as some of my reflections coming out of the pandemic and what I've learned and what my teams have learned as we move forward into building a more resilient healthcare system. As Leslie had mentioned at the beginning, my name is Sharon Isaacs. I'm the Vice President at University Health Network. My focus over my 2-decade career at UHN has been focusing on really care outside the walls, focusing on outpatient care, community integration, and partnerships. I'm here to talk a little bit about that today. But more, just a little bit of context of where I live and where I work. I'm very proud to be from Toronto, Ontario. It is one of the most diverse multicultural cities in the world and home to over close to 7 million people. It's also home to where I work. I work at University Health Network, which is a world-leading healthcare organization, #1 research hospital in Canada. And I'm really proud to say that it is truly, for many across the city, across this province, and across this country, sometimes a place of last hope. And it's a true privilege to be part of the University Health Network team and helping to continue to drive care in the vision that we have around a healthier world. My work here, though, is not just about a career and a job. For me, my work is personal. And my why is this picture here today. This is my family. This is the picture that was taken in the spring of 2018. And if you asked me several months in advance of this picture, if I would have all of my loved ones here together in one picture at the end of this 12-month journey that I was on through 2017, early 2018, I would have said no. I'm a dad, I'm a husband, and I'm a caregiver. And in the 12 months leading up to this picture, every individual in this picture was faced with a serious life-threatening health event. And I found myself crisscrossing the city and the province as I struggled to navigate and access the right care at the right time for each of my loved ones. And there were moments in hallways and beside hospital beds where I wasn't sure that I would be able to provide the support or get what we needed to make sure that my family members each survived and thrived out of their very life-threatening healthcare events. So this is why I do the work that I do. I think about this picture often, and I was just so proud that on that spring day in 2018, that through everything that we've been through as a family, we were able to be together and have this moment. So what does that really mean in terms of the work that I do at University Health Network? It's coincidental that also in 2018 is when UHN began its integrated care journey. We spoke to patients, we spoke to providers and caregivers, and they told us a number of things that I rolled up into 4 themes here. What were some of the challenges we asked them around how you access and use the healthcare system? I've boiled them up here into these 4 themes. Care coordination. How can we coordinate care, both from primary care into hospital and back into community, and the varying and winding paths you take as a patient or caregiver on your health journey? And care coordination and those transitions of care were really paramount to many that shared their feedback with us. Communication and continuity of care, another critical issue that we've heard of, where there's tons of confusion, sometimes over communication and sometimes under communication, and really understanding the journey isn't just in one institution or one healthcare setting, but really is something that you're trying to transverse in a very complex and sometimes difficult health system. Easy and timely access is another issue that we've heard loud and clear. From the time that you are made aware that you may need support and help to the time you get that care, or your awareness of how long you have to wait, and where are the best options for you in your particular situation. All challenges that I've heard, not just from our patients, caregivers, and our providers, but in my work, and especially meeting with Leslie and some of our international communities, something that really, I would say, resonates with many, many parts of the world. And lastly, customizable care. We look at having standards, which is important, but also making sure it is personalized and specific to the patient and where they are and what they need as a whole person. And this is something that we've really focused on as part of our integrated care strategy that I'm proud to be supporting at University Health Network. So what did we come up with? These are the 4 pillars you see along the bottom of the integrated care model that was established and now scaled. And I'll share a little bit more about the results of this model on the subsequent slide. It starts with one team. From the time that you are looking to come to our hospital or our hospital system, to the time that you're recovering at home, you're supported by one team that works together, that communicates together, and that really coordinates together. And this one team with one point of contact, we're happy to introduce a role which we call the integrated care lead, is the individual with a person and a name that you're given before you arrive at the hospital, and that supports you through your journey and recovery back at home. That integrated care lead, as part of our one team, is a signature element of our model. What we're also working on now is that story that you could tell through your digital record. And we know that we have islands of digital information across our health system, but establishing a single narrative, a story for our patient, and having a digital platform to support that is part of our mission and our goal as we develop our integrated care model. We also are very proud to have a 24/7 1-800 number that is accessible to patients and caregivers before they arrive at the hospital, during their stay, as well as part of their recovery at home. This number has been one of the most favorite, I would say, features of our model when we hear from our patients and caregivers, because they know that they're not alone. They know that when they are leaving the hospital, they're not discharged, but as they begin their recovery at home, they're going to be supported and they have someone that they can call. And when they call, they are aware of who this person is, what their particular issue is, who is their care team supporting them, who is their integrated care lead, and all those elements not just bring down anxiety, but also build the confidence of our patients and caregivers around that they're getting the right supports and care at the right time. And finally, we are established to support from our funders and health system leaders an integrated fund. Typically in our health system, hospitals are funded separately from our home care teams, from our community teams, and our primary care teams. In this model, we've been able to establish one integrated fund where we're responsible for the care from in the hospital and into the home. And that allows us the flexibility to be more bespoke in our care, to ensure that some patients may need more and other patients may need less, but it's the right care for that patient and their journey. And our integrated care lead is working very, very closely with the inpatient teams and the home care teams to allow that to occur. So this is the model we put in place in 2018 and have been built ever since. We're actually at our 5-year anniversary this month, and it's hard to believe that we've actually been able to really scale this model across all our surgical programs, our medical programs, as well as our transplant programs. We now have 15 clinical pathways in existence as we rapidly expanded over the last 18 months. Also proud that we now support over 4,000 patients annually with this program, and we continue to look to scale that up. What we've also found through some robust evaluation is that we are able to now, through this program, increase our inpatient hospital capacity while decreasing elective stays, reducing our emergency department visits, as well as any unnecessary readmissions. We call that your total combined length of stay, and it's something that we track very closely because we believe through this model and through using an integrated fund and the team that we have in place, we aren't building more beds, but we're able to shorten length of stays and increase that capacity that is so needed in our health system. And most importantly, we have a very, very high satisfaction score from our patients and caregivers. I'll share a couple quotes that were shared with me from the team. When patients return home from the hospital, they think they are being thrown out, and they think there are no supports for them. But now with integrated care, they know they will be supported. And this comes from one of our patients. We've also heard from our personal support workers. I'm going to talk a bit more about our personal support workers in a second. But one of our personal support workers who works in the home said the integrated care program provides seamless and effective care to help people, encourages us to work together. And finally, one of our dietitians noted that the program is less time consuming and it's easy. And when you are faced with providers who are really challenged with burnout and over administration, to hear it's less time consuming, to hear it's easy is something that's important to us as we move forward. So what does this all mean? And I want to boil this program into one particular person. Her name is Florida. She's one of our personal support workers. That's part of the integrated care program. Florida was a nanny before she arrived in Canada and did her personal support worker certification. As a personal support worker in Ontario, you're usually tasked to working with an agency where you're assigned a patient and you support them on a regular basis at home with activities of daily living, dressing changes, etc. However, in that model, it is difficult for Florida and other personal support workers to help escalate or coordinate with other members of the patient's care team. And in this model in integrated care, when Florida joined, she was a little hesitant to join, but when she did, what she found is that she was not an individual working alone in the home, but part of a broader team. Florida has a very important role in that she has eyes on the patient at home, more so than any other member of the care team. She's able to reach back out through the integrated care lead directly to the physician or nursing team to let them know if one of her patients aren't looking well, looking to decompensate, and we can escalate that support where we can provide more support in the home or help bring that patient back into the hospital without going to the emergency room. So in this situation, Florida is empowered. She's part of a team, and she's provided the support and training to really work to the top of her scope as she supports our patients home. These are probably one of the most incredible and critical roles for us as we go forward and face some of the healthcare worker shortages we're seeing across the system. So when I bring this back to the principles of integrated care that we see from the HSO Integrated People-Centered Health System Standard of 2021, the principles of system leadership, shared governance, aligning on funding and incentives, seamless access to flow and transitions. These all resonate with me and is what has been part of our journey as we move ahead. And it's something that we're helping to contribute to. And I look forward to Accreditation Canada and HSO and others to help not just with organizations and looking at these standards, but helping to showcase this work and the standard to funders and policymakers as we continue to try and build a better system. So I'm going to leave you with two reflections from my time in the pandemic. The first one is a reflection that I heard from one of our senior leaders at a talk, and I thought I would share with you today because it really resonates with me. What happens in the hospital is a direct reflection of what happens in community. And the reason I say that and why that resonates so deeply is I want to show you a graph. This is a map of the city of Toronto. The darker colored areas are neighborhoods that are high income. The lighter areas where you see in the northwest and the east parts of the city are areas of low income. And these correlate very closely with equity deserving neighborhoods. And what we found in the pandemic, and this existed before the pandemic, what was exacerbated through the pandemic, if you look at this same map now, and you look at our vaccination, as well as our COVID hospitalizations and deaths, you see it's highly correlated to the income, and not just income, but really looking at these neighborhoods around access. And what we found in our COVID units during the pandemic was they were disproportionately full of people from our equity deserving neighborhoods, which were some of our lower income neighborhoods across the city. And really that we are truly as a city not accessible to all members of our city. And this is something that I've taken to heart. What I've also found is that healthcare needs to meet people where they're at. I had the great privilege during the pandemic to be the co-lead for the City of Toronto for our vaccine equity strategy. And what we found is that we could not just rely on our mass vaccination clinics to help support all the members of the 7 million residents of our city in terms of access to vaccines. And so what we did is we brought care as close as we could to home. In this example here, we had set up vaccine clinics in basketball courts. We used the playgrounds as observation areas, And in a lot of instances, we would go building by building, setting up clinics in lobbies, and in certain situations, go door to door as well. What I learned through all of this is that over half the city could not access our clinics because either they weren't aware of them, or they worked a job that didn't allow them the hours off to go, or they were caregivers or parents that it was hard to step away to try and get your vaccine. So by bringing care, and I just don't mean vaccines, but when I think about in our post-pandemic world, bringing healthcare closer to individuals in a way that they can best consume it is a critical piece of our work going forward. What we also found as we did our vaccinations by buildings is that there were a lot of buildings that had residents that were over 65. And there's a program that we started at UHN in partnership with a team called Open Lab called the NORC Innovation Center. And NORC stands for Naturally Occurring Retirement Communities. Buildings that have over 30% of the residents over 65, or at least 50 residents that are over 65. These buildings are helping, and the NORC program is helping residents in these buildings to age and stay in place at home rather than move into long-term care. And through NORC ambassadors that we put in place in these buildings, they're helping residents stay healthy and get healthy. And our goal here is we have over 489 of these buildings in the city of Toronto, is how do we create this, expand this NORC model where community ambassadors are supporting patients in terms of access and navigation. This last picture is a NORC event happening in one of the buildings where some of the residents were interested around falls prevention. And so they got together with their NORC ambassador, had teams come in and educate them on what that would look like and support them. And we believe this is part of a future of healthcare where we're activating and supporting our residents to age in place, but also to support their access needs going forward. So I'll wrap up with just a picture that I find very helpful. This is part of the team that I got to be supporting through the pandemic. What you don't realize in this picture is there's 2 hospitals being represented, primary care, community volunteers, and community leaders all working together to support our mobile vaccination effort. This, for me, is the future of healthcare, where we're working across community, across health and social care, as we support patients who don't have the access that they deserve and need in our healthcare system. So I've shared a lot with you today. What I will say is the future for me is continue to drive new models of care, like our integrated care program, empower care providers to work to their top of scope, because we certainly don't have enough providers to help everyone, focus on equity as a lens as we look at all of our work, and be hyper-local in our delivery. Leslie, I'm sorry if I went a little bit over, but thank you for the opportunity to share my story.
Now that was fantastic. You can see with all the accolades and hearts and claps coming your way that your comments really resonated with people. I want to thank each of you have really helped build out an overall fantastic perspective on resilience and health system resilience, and showed really specific ways in which the language of standards can guide the preparation and the foundation for action. I think, Shren, you also, though, reminded us that standards and personalization, it's not a one size fits all. And I think, Monica, you also really illustrated that as well with, it almost would seem counterintuitive in some ways in which how standards actually can be used to support cultural safety and humility. And Joanna, also with that, you really took kind of global international standards and assessment criteria and customized that, localized it so that it was relevant for you in your specific circumstances. So thank you all for showcasing those kinds of great examples. We have some questions from the audience. We've got almost 30 minutes, and I'm going to bring some of those questions and pose them to each of you, and picking out the ones that I can. I apologize to people if I don't catch all of your questions. We will certainly find ways to continue this conversation, because feedback that we're getting in real time is that this is really resonating with people. one of the questions for you, Joanna, and is around the preparing for that kind of future shocks and stress in the system. I think that most people would believe that it's not whether there will be another one in almost any community, but it's when. What has been the most challenging part of really engaging all the players that are required to support that preparedness from the community, the different providers, different organizations, bringing people together around a common plan to be ready? Can you share with us some of the challenges and perhaps the kind of one piece of advice for others?
Okay, so while we're actually preparing for the accreditation standards, I think one of the most challenging part of it is the business continuity plan. Because of the inherent complexity of the plans due to the cross-disciplinary nature, requiring the integration of multiple departments. And as what you've said, also it requires the collaboration with external participants and stakeholders. But I think it's very important that the iterative process of testing and refining these plans, which involves, as what in my presentation have shown you, involves regular drills and simulations, and also getting feedback from these simulations. Sometimes this could be resource intensive, but at the same time, these are essential in identifying the gaps and areas for improvement. And each iteration helps us to better understand interdependencies among different organizational areas, enabling more streamlined and coordinated response. I think also one advice is that do not forget to be agile. And I think it's one of the things that made us successful in terms of disaster preparedness and crisis. The ability to move and whatever is happening in front of you. And I think most of all, whatever success that we've had in the past, in the present, and for sure in the future, it's going to be because not only internally, but because of our collaborations with our external partners, governments, and other healthcare organizations.
Thank you very much, Joanna. On this theme of connection, collaboration, engagement continues to be really the kind of the key ingredient. Those are the key ingredients for building that resilience. It's not anything that any one group can do on their own. And in that theme, also, Monica, there's some interest in terms of the what do you think that the biggest impact of the BC Cultural Safety and Humility Standard is having in it related to kind of inspiring action, and so that there is kind of a movement from, yes, this is nice and good to do, to actually bringing it to life. I think just building on I think there's questions around, like, how do you, for people who aren't deeply in your circle right now, what's your advice to others to think about what can they do to build on the lessons in other provinces, potentially other countries? How do people get started?
Thank you, Leslie. Great question. I think there's a few different questions in there. I think what I would first of all start off saying is that for the standard, it's actually a place where people can start having the conversation and start giving them the words and the ability to look at their own practice and their organizational practice as well. And I know a lot of people have expressed a lot of interest, and they're curious and they want to know more. So it's a tool like any standard that people can use and really start those very intentional conversations with their either direct supervisor or with their staff teams, and to really look at, hey, how can we start the conversation, start implementing, doing the work. And it is overwhelming because there's so many different pieces to it, but even just the ability to focus and look at the reference standard as a way to judge their own organization in an intentional way. So I would just recommend people to, first of all, look at the standard, see where they are. And even if they put together their own community of practice or a working group to look at it and start the dialogue and the conversation, because I think there's lots of interest around it. And it's just a way to start that conversation with other people who are interested as well. And I'm really excited to know that other people have been interested. There's been lots of interest around the standard, which is really exciting for our organization to hear and to really promote the good work that has happened. And we are really looking at putting it across Canada and making it a national standard. There has been huge interest around that. So I am grateful for the partnership with the Health Standards Organization, Accreditation Canada, and First Nations Health Authority for really leading this good work and doing it in collaboration with the First Nations people and Métis Nation. So it's been a lot of exciting good work, and it's just a platform to start that conversation if you're not from British Columbia.
Thank you, and it really speaks to that building of kind of capacity and capability of people to understand the needs, meeting people where they're at as well. I think is a common theme also that we've heard across all. It's not about just kind of leaping to the end state. You've also spoken very much about the journey, and I think that personal experience as well with all of those who were involved in the conversations helps build that resilience. Is that right?
Yes, and it's that relationship building, that really hearing one another. And I think that is sort of the foundation of the work that we have found when we did our own internal assessment. It really is around the relationships. And in order to have a relationship, you need to hear one another and build that trust. And you do that individually and as a system and different programs. And it just goes out and out depending on your sphere of influence that you do have.
I've got one more question that also kind of stems from this too, just to keep on this theme around building trust. What's your advice when you are through this process and your self-assessment where there's things that are uncomfortable to hear? How do you think about that as part of on the positive way in terms of building and strengthening resilience? But how do you handle that? And or what advice do you have for people in that discovery process when they're hearing things that are uncomfortable or difficult?
I think, and I sort of mentioned this in the presentation, but it's around creating the safe spaces where people can share their discomfort, and it kind of goes both ways. Sometimes people in the system, the healthcare workers, the staff, they are uncomfortable as they are unlearning some of their inherent biases that they might have had, and they need to be supported to do that in a good and safe way so that they continue to learn. I think if people aren't supported in their learning journey, they're not going to be open to learning. And we need to be able to hear from the clients and the patients when they're not feeling safe. And it's okay to be uncomfortable and to sit in that being uncomfortable, but that's how you're going to learn. And that's what cultural humility is that ongoing checking your own learning and where your biases are at. So yes, sometimes it can be uncomfortable, and that's a good thing. And we don't want to minimize it, but we need to be able to support people to be uncomfortable so that they can learn and grow and challenge themselves, but also the system. So we don't want to, we always want to make sure that we're a learning organization and to move through it in a good way, in a positive way. And that comes from respectful communication and hearing from one another, and be open to that feedback and not to shut it down if someone's having a kind of a challenging you in their conversation. So I would just really encourage everyone to be comfortable in that space of when you're uncomfortable, and to just encourage those conversations to happen.
Thank you. And that, the whole focus on kind of cultural safety as another dimension of how we think about safety. And Joanna, was really squarely in that physical safety, also bringing in some of the notion around how the workforce needed to feel about the various initiatives, which brings in the psychological safety as well that's required to advance these. And the cultural safety altogether are a much more comprehensive view of safety and resilience than I think that we've had before. Sharon, building on that, from the experience of your connected care program, one question was, what does you mentioned around lead with an equity lens, and can you just give us a bit more understanding of what do you mean by that, and how does that connect with the notion around building and strengthening resilience at the community and level?
Thanks for the question, Leslie. And I would say I'm very much on my own learning journey around equity. And I think what I learned to date is really the focus on listening. And I think that is a huge piece. I've heard this from the other speakers as well, is where listening on what the needs are versus making your own assumptions of here's what we think we should do. And so when we look at this as a hospital, I'm also acknowledging when I'm listening that I have a certain position in power as an institution, and I have to appreciate the history, potentially mistrust that individuals or communities may have with various healthcare organizations or institutions of power. And so going to those conversations, not just listening, but also with the mindset of doing with versus doing for. As a hospital, compared to the other parts of the continuum, we may have more infrastructure and support, but doesn't necessarily mean we understand everything that's needed at a hyperlocal level. So we can bring some of that capacity, but through the leadership of community is where we've really found most of our success. And it all started for me with listening. I would say after listening, and it's great to listen, but it's to follow up and deliver on what you committed. And I think that's the part where day after day, week after week, by listening and following up and keeping to your word and continue to come and support and not make this just a one-time event, is helping us to build that trust. But that's something that's an ongoing process that will never, ever complete, but continue to journey on.
And I think that's a really kind of a universal kind of practice and or insight, that we've got some questions around how some of these ideas can scale or be relevant in other countries, in different lower and middle income countries, as well as in the more higher resourced countries. And I think that the kind of the foundation that you've set, as well as with Monica around that building trust, and Joanna illustrated it across teams, is something that is truly a global. It's relevant globally, no matter where you are in the world. And thinking about how to take ideas and foundations and build on those. What would be your thoughts around scaling the lessons learned from the connected care program? Where do you see the opportunities, and the barriers or challenges is one of the questions as well.
Thanks, Leslie. Scale is something I think about a lot. The programs that we look to support is really built on scale. And as I mentioned at the beginning, there's over close to 7 million residents in the city of Toronto. And how does what we do in one area with one of our hospitals, many hospitals, many healthcare providers, for me, scale is that piece earlier around the standards. And I think I heard this quote that I wanted to share is the reason things don't scale is there are too many options to say no. And I think for us, having the ability to set the standard, but with the flexibility of how that's delivered locally, is that balancing act. It's putting the systems in place and ensuring that we have that capacity, but to really be able to ensure that it is personalized to an individual in a community. That's what we focused on. And again, through the last 4 years, I've seen that happen across our city in terms of standing up integrated delivery teams. There were standards, but it was also delivered in a very bespoke way. And I think we look at that as having a backbone team. So Connected Care really is a backbone team for our organization, but is also a backbone and anchor team for Toronto region. And by having that dedicated backbone to support those standards, to support the scale, but while having trusted relationships on the ground is what we have really been focusing on and where I think our strengths lie. But we've been around for 20 years. So we have those established relationships in the community and continue to build more. When you put those pieces together and have a team that's dedicated to it and not doing scale off the side of their desk, has where we've seen many of our successes to date.
Thank you. And I think when you think about resilience and kind of being ready, well prepared, it does require very much kind of seeing what might have been invisible before in terms of the typical traditional tables around what do we need to solve this problem and who needs to be involved and engaged in helping to create those solutions. You've all talked about the importance of kind of co-design, co-creation, collaboration as being essential ingredients in terms of building up that perspective. I'm wondering, as well as we kind of draw to a close, what are your thoughts based on the conversation today and your experience of real messages for people in other countries, other jurisdictions, around how they can put to use the lessons learned from your experience of building resilience in your communities, from disaster preparedness, cultural safety, humility, to really integrated, connected care that's grounded in the reality of where people are in their communities. And I ask you, each of you, for kind of a thought and an advice to others. Joanna.
Yeah, thank you, Leslie. I think it's very important to really assign a specific person, team responsible for resilience. I think it's very important to know who is really accountable. It should start with that. And whoever is assigned to manage, it's also very important that these people has the authority and provided the right resources, and also to collaborate with key external stakeholders. That is very important because when we were even preparing our own resilience and disaster preparedness and crisis management, everything followed when we assigned a specific committee to follow with the standards, to follow with the things that we need to do. And all of the roles and responsibilities and accountabilities are very clear. And of course, we are also measuring our progress. So I think you should start from that. And when you assign people, we should also support them. We should provide them the proper resources. And I think that could be a great takeaway from our personal experience here. Thank you.
Great. Thank you very much. And that certainly having standards and accountability systems that are clear and also that transcend some barriers and boundaries of typical organizations is really important that you've brought out. And it is one of the features that that other experts as well reinforce your very important point of saying is a key characteristic of resilient health systems. So thank you for that example. Monica.
Thank you, Leslie. Great question. I think I'm going to use the metaphor of building a muscle for resiliency. I think it takes time, it takes consistency, and it takes work. And it's foundational to the strength of an individual and the organization. And so if you look at the example of the reference standard for culture, safety, and humility, it took 4 years for the technical committee to get it to where it could be fully endorsed. And I think it was that regular coming together despite COVID and doing that hard work and building it up. And then, so the learnings would really be that it takes time. And when you want to have that strength of something where it does impact people's and the organization's resiliency, to not rush it because it's foundational. But if you do the good work, then it's going to really pay off. So just be patient and know that it will be foundational and it will have the outcome, the desired outcome, which will help everyone be more resilient across the system.
Trent.
So maybe I'll just add to this in terms of the 2 great responses. I think about shared purpose for collective impact. And as organizations and teams, we're working from one vantage point. But what I've had the privilege of looking at is more of a bird's eye view of the system and looking at what's happening to the left and right of us. And so when we're able to, and then Monica agrees with you, it takes a lot of time to do this, but where can we come together on shared purpose? We saw that happen in the pandemic because it was pretty clear what we need to do. But as we come out of that now, we're going back into our own organizational priorities. But when we step back and look at what is a broader shared purpose, and then find the people that are looking to do that work, and that's what really, I think the journey we're on as Connected Care right now is continue to reach outwards, learn from others, but also look for ways to leverage this work without having to create our own version. What I didn't share with our integrated care model, that model was established in 2011 at a different hospital. We didn't try to change it. We took that model and leveraged it and scaled it. And so for me, I think that's a big piece, but because we did have that shared purpose between organizations and found the people across the system to work with us.
Thank you all for your great kind of comments and insights. I think there's a lot of questions that are really in the same themes of what we've just discussed. So I'm going to kind of wrap up now and tie back to the theme in terms of the resilience within the context of World Accreditation Day. And thank you all so much for contributing to that. You know, at Health Standards Organization and Accreditation Canada, our vision for that really drives everything that we do is safer care and a healthier world. And all of you have given kind of great examples that are contributing to that shared vision. It's kind of a common purpose that brings a lot of us together, and it is you've all showed different dimensions around safety in its broadest sense, and how the approach with collaboration and co-design and co-creation are really helping and focusing on vulnerable populations, as well as ensuring populations aren't vulnerable to, even when they've got good practices and things in place. Things can go wrong, and those are tested. And you've all given great examples of how your work is also contributing to that vision of a healthier world. When I think about the work that we are doing with all of you, as well as in over 12,000 locations, 40 countries, and across 5 continents around the world, the role of standards, you've also done a great job of articulating the way that common language and the use of standards can still be, can drive changes in behavior, can drive very concrete shifts in ways things are done to improve outcomes and to build and support resilience and healthy places for people to work, live, and play. And this is a great way to be thinking about why standards matter, because the language, when it's there, people mobilize time, energy, and resources to meet them. And if you've got common language that really fits the kind of the problems and challenges that are most pressing to improve health and well-being of individuals and societies, it's incredible to think about the power of change that we can all contribute to. And that's where standards and assessments come in. Assessments and accreditation, those are tools to help build awareness of where we at, where are the gaps, what needs to continue to improve to help foster the learning that can really propel us toward the better outcomes, better health, and well-being from all those that we serve. So thank you so much for your expertise, your knowledge, your ability to share really complex and incredibly well-developed programs and services. And you've shared those in such beautiful ways as presenters, weaving in the concrete evidence and description of what you're doing with the personal stories and bringing this to life through in such wonderful ways that will make it memorable for people to take away the great contributions that you've made to this whole topic of improving health system resilience. So thank you all again. Thank you on behalf of all of the participants. There's just fantastic feedback here. Thanks to the team at HSO and Accreditation Canada for pulling all this together so that we could share this with everyone. And this will be posted online. I believe it's all on YouTube, and the slides will be available. We've put in links to other resources. Keep learning. Keep being curious and keep connecting with each other. And we're so happy to have all of you as part of our global community with HSO and Accreditation Canada. Happy World Accreditation Day, and all the best to all of you in creating safer care and a healthier world.